This program is sponsored by
Lanka Hospitals. Caring, curing.
Hello everyone, welcome to our television's Mediline. We conduct this program to spread awareness on health and well-being so that you could make the best out of your life. We are in collaboration with Lanka Hospitals, one of the finest establishments in Sri Lanka, providing the best of medical services for Sri Lankans as well as international representatives, of course through the best of specialists. When talking about the specialists, it's my pleasure and honor to introduce you to the guest of the program today. She is a consultant neurosurgeon with over 10 years of experience and specialized in brain tumor. She practices in Sri Lanka as well as in the UK. She is Dr. Ruvini Abeygunaratne. Hello doctor, nice to have you with us today in the program. First of all, I would like to thank you for being with us for today's program.
Thank you very much. It's nice to be here.
Great. So to start with the conversation, first of all, I would like to ask about your experience. You being a doctor trained in the UK and practicing it in both countries, we would love to hear about your experience.
So I did most of my training, including medical school years, in the UK. So I trained there and lived there for more than 25 years, then decided to move to Sri Lanka. So all my neurosurgical experience prior to moving to Sri Lanka was in the UK, and I was trained there. My training took part in general neurosurgery, and then I concentrated on neuro-oncology, which mainly is the speciality that concentrates on brain tumors, and in this, both pediatrics and in adults.
Since you're specialized in brain tumor, educate us a bit about the pediatric brain tumor, doctor.
Yep, so pediatrics is a speciality or a subspecialty by itself. So we can never treat children exactly the same way that we treat adults. We cannot treat children as small adults either. So they're a completely different entity. In different parts of the world, a pediatric case could be either children below the age of 16 or below the age of 18. For instance, in Sri Lanka, it is termed to be below the age of 16, but sometimes you don't have the maturity at the age of 18 to make decisions, in which case a guardian does it. Pediatric brain tumors are a very sensitive topic, and it mainly involves the growth of abnormal cells in the brain tissue itself or in the surrounding structures around the brain. Okay. The way we deal with these, the main point to come across should be that we need to be able to recognize the symptoms and signs and the prognosis these children will end up having with these tumors. Now, a lot of things depend on where the tumor is located, what type of tumor it is, the age at which the child presents with the symptoms and when it's diagnosed, and also whether it is accessible surgically or whether it can be treated or not. And for all of this, it is very important that we recognize the symptoms and signs that can push us into that category of this being a significant symptom and start the process of investigating children for these.
Since you said it's very important to recognize the symptoms and signs, I would like to ask the question, what are the signs and symptoms that can be identified in the children?
Okay, so it depends on a little bit on the age of the child. For instance, if you have a very young child who's still not speaking, is unable to communicate, their parents might notice a difference in the child. For instance, it might not want to feed properly, or there might be a period of failure to thrive. They might observe that the child is very lethargic, it's not interacting with the parents as much. It's not always that a child with something going on in their brain is able to vocalize the fact that they have a head injury, a headache or symptoms such coming from a tumor. There may be other signs, like the child might be vomiting, or the child might be unable to concentrate on something, or shapes and sizes, or may not be able to hear or see when the parents or the mother in general is trying to interact with the child. Those are the very small children. When we go up, further in age, things change. So you might have a child who is in their sort of before their teenage years describing headaches, which is very common in brain tumors. They might say that the headaches are worse in the morning when they get up in the morning and it's really bad, and it's very commonly associated with vomiting. And they find that throughout the day the headache gets better and then comes on again in the morning. Generally in tumors, the headaches are progressive. That means that with time the headaches get worse in intensity and the child might not be able to concentrate on their schoolwork. So you might see that they're dropping off in their grades at school. They might not be able to interact with other children. Their personality might change. For instance, somebody might become quite aggressive who was a docile child before that. So these are some of the symptoms that you get with older children. There are other specific signs and symptoms which come on, which are really connected to where the tumor may be, if it is a tumor. For instance, you could get a weakness in their body. You know, they might not be able to speak properly. Their speech might be affected. Their vision might be deteriorating rapidly. Their hearing might be going. There might be cases where they're unable to walk. They might have been a track runner for a while and all of a sudden they can't walk or run or do anything. So these are things which are progressively worsening, need medical attention and need sort of directing as to where to get help from.
So in this process, how do you diagnose this brain tumor and who are the personnel involved in the investigation process?
Okay, so the most important people, a lot of times what we hear is that the parents have been repeatedly going to doctors and they've been saying, oh, it's part of growing up. Okay, the children rarely complain. It's very important. It's not like adults. Adults complain about a lot of things and come early. But children rarely complain about headaches and symptoms such as vision being affected, hearing being affected. And the parents see this. And most of the time we see that they've gone to multiple doctors because they've not been taken seriously as such. So the first person to go and get a good examination started and a history taken is the general practitioner or the pediatrician that the child is under. They have known the child since the child would have been born, and they would be able to make an assessment of the child to see if there is anything going on. After that initial history, what happens is if they feel that there are concerning factors, they would generally say get the child seen by a pediatric neurologist who concentrate on the neurological examination and the system. If a brain tumor is then diagnosed, it becomes a multidisciplinary approach to treating that child. So the neurosurgeons get involved. So it's a collective. So the parents are the main people who will point out that something's wrong with the child themselves, a general practitioner who looks after the child, or a pediatrician who has known the child all its life, and then a neurologist and a neurosurgeon. So that's the team that's involved. The second thing that happens is the diagnosis involves a certain cascade of things. The first thing is a good history and a good examination by a neurologist. So the child's examined from top to bottom, their eyes will be looked at, their hearing will be checked, and neurological tests are completed. Okay? They then would organize certain investigations. So the commonest investigation done if we're querying a brain tumor is an MRI scan of the brain. Now, the MRI scan in small children is very difficult to undertake because they can't move around in the scanner, and if you've ever seen an MRI scanner, it's a very claustrophobic experience. So we normally give them sedation, make them half sleepy, and put them in the scanner. That gives us a lot of information regarding what's going on. Then a barrage of medical and blood tests will be done as well, because some tumors are associated to that. And then pending what you find on that, and pending whether the child needs further investigating, you would organize more specialized testing, which a neurosurgeon or a neurologist does.
So doctor, after diagnosing this brain tumor of a child, how do you treat the child? What is the process of treatment we would like to, if you would like to elaborate on this?
Okay, so first of all, if a child is diagnosed with a brain tumor, generally we have a discussion with the parents and the child, if the child is old enough, and the other medical professionals that are involved as to what the best treatment would be. Depending on what the tumor looks like and if it is accessible, we would offer surgery. Now, surgery in the pediatric population is very complex, so consenting is very important when it involves somebody's brain for obvious reasons. So you have a lengthy discussion with the family, explain the risks involved and consent. So if I take you through what we do in surgery and how we do it. So say for instance we diagnose a brain tumor, we would first get all the investigations done that would make surgery easy. Okay, so an MRI scan, and we also have an MR navigation which is available, which is like a GPS for the brain. It tells us exactly where the tumor is and whether it's attached to sensitive structures, or whether we can take it out completely or we can only take out part of the tumor to help with the symptoms. Before we take out the tumor, we explain to the family again that the child may require to be on medication after it. We might need to load up the child with anti-epileptics because manipulating brain tissue can actually cause you to have seizures as well. And we get a pediatric anesthetist involved as well, who will keep the patient asleep and manage the patient during the anesthesia and after the operation as well. Then, depending on where the tumor is, we plan our tumor surgery. So we get the patient in the day before. Again, making a child familiar with the environment and comfortable is very important. Then we mark out where we need to go in. We do that on a console, either in theatre or outside in the scanner. We have a plan of action, well I have a plan of action and my colleagues do as well, as to what we tend to achieve during surgery, and then we take the tumor out. So the theatre process is quite smooth because already in our heads we know what we're going to do. So child is taken in on the morning, anesthetized, then we may have to shave the hair, we put monitoring on, we make sure that we take as much tumor at all as possible. Sometimes during theatre we send a sample off to find out what it could be. For instance, if it's something that's benign and we cannot take all of it out, we might come back at a later point, or we might leave it because that means that it's not a non-cancerous tumor, so we can afford to leave it. If it comes back as a very aggressive cancerous tumor, then our goal is to take more than 95% of that tumor out. So we do it as carefully as possible without causing damage to the normal tissue, which might cause the child a deficit. After surgery, the child is normally sent to the intensive care and we recover the child slowly, make sure the parents are available around, and then hopefully transfer to the ward after a couple of days. When surgery is done, that's just the beginning of treatment. So what we then wait for is the confirmative histology as to what the tumor is exactly. And that takes about 7 to 10 days. Till that comes, we look after the patient on the ward and try to get them back to their normal day-to-day activities as soon as possible. Okay. When the histology arrives, the rest of the management depends on what it is. They may require further radiotherapy, which is given elsewhere, or they may require chemotherapy as well, depending on what it is.
Great. So in the middle of this valuable conversation, we would now like to take a small break.
You're watching this program sponsored by
Lanka Hospitals. Caring, curing. Lanka Hospitals. Caring, curing.
Welcome back to Art Mediline. Today we are in discussion with Dr. Ruvini Abeygunaratne, consultant neurosurgeon specialized in brain tumor. And in the previous session we had a discussion about the child brain tumor, and right now we are going to talk about the difference between the child brain tumor and the adult brain tumor. So doctor, brief us a bit about the difference about these two.
Okay, so adult brain tumors can be primary brain tumors or secondary brain tumors. That's the first main thing that we need to know. Primary brain tumors in adults are those which arise from the brain tissue itself or structures surrounding the brain or the lining of the brain. Secondary brain tumors in adults are mainly those which are cancers elsewhere in the body which have traveled in the bloodstream to the brain. These are also called metastases. So these are also brain tumors, but they're secondary, and the way we deal with primary and secondary is slightly different. So in adults, unlike in kids, they are able to give you a better history. That's the main difference. They're a different entity, and in brain tumors there are generally two peaks in which they present, either in their 40s and they can be later on when you're elderly. There are also a set of people who can develop brain tumors because they have a genetic predisposition. That means the DNA has some kind of mutation which causes them to get brain tumors, and that can be familial, that can run in families. So there are certain symptoms and signs in adults as well as children that we need to be aware of and should highlight the fact that could this just be something that's starting off. Seizures are very common in adults, and their first presentation of a brain tumor can be a seizure or a fit where they have never experienced it before and they present with a seizure. Early morning headaches are very common. People describe headaches which are really bad when they're getting up, or a heaviness in their head which progressively worsens during the morning hours, and when they're walking around and carrying on with their day they get a little bit better. Vomiting, nausea and visual problems are also very common. So they may come to you saying that they've got a sudden blindness in their eye, or they've had to change their glasses, or they find that their sense of smell is affected, or they find that their hearing is gone in one ear, and that has been sudden. So a 35-year-old coming in with hearing loss or tinnitus or ringing in the ear, we have to investigate as to whether this could be a tumor or not. There are other signs and symptoms. A weakness, you can present as if you have had a stroke. So a paralysis on one side of the body, or inability to speak, or loss of consciousness. All of these things can direct you to a possible tumor, especially if the symptoms are not getting any better. There is also, if people have tended to have migraines and headaches throughout their years, and these change in characteristics, this could be because there's something developing in the brain as well. With other conditions as well, say for instance you've been diagnosed with a cancer elsewhere in the body, the first presentation could be headaches, vomiting, again seizures, and these could be the first signs of secondary brain tumors. So when symptoms like this appear, the main thing is that they are directed to the right professionals at the time, so that timely organization is done for this and management is started early.
So since you spoke about the signs and symptoms of adult brain tumor, when they're directed to the professionals, how do they diagnose this and how is the treatment being done for them?
Okay, so the main thing in adults is they need to be examined and a clear history taken, and that can be done by a general physician or a neurologist. This is their first port of call. It is only when we as surgeons get to know about brain tumors when they are referred to us for removal or for an opinion. So what they do is, initially, investigations are organized. The first investigation to be done, as in pediatric brain tumors, is a scan. So they will have an MRI scan, which is a magnetic resonance image, which gives us very fine details about if there is an abnormality, where it is, the position of blood vessels to it, is it accessible, can we take it out, is it, and even the appearances of the abnormality can tell us to about a 90% guarantee as to what kind of tumor it could be. When we're thinking about secondary brain tumors, it's also very important that we know the number, because you might have lots and lots of minute brain tumors there as well. So the management of that patient is completely different to the one that presents with the primary brain tumor. So apart from the MRI scan, we would also probably request an angiogram, which is where we check the association of the blood vessels to it. We can also get MR spectroscopy, which is available, which gives us an idea whether it could be an infection compared to a brain tumor. We can get CT scans, which are rarely used in brain tumors these days, but a CT scan which also looks at the bony structure associated to the tumors and helps us with aids to how to attempt to take these tumors out. So apart from these imaging or investigations, we may also request EEGs, which is looking at the brain waves to see if they are affected, and also blood tests as well.
So listening to all these treatments, I'm sure the public has a question as to whether all these treatments are available in Sri Lanka, and if so, what are the special services provided by Lanka hospitals with this regard, doctor?
So I'm in a unique position because I work in the UK as well as here. So I'd like to reassure anybody, not just in Lanka. Lanka has all the facilities available for operating on these tumors and for the treatment and management. It is on par to the equipment and all the facilities available in the UK. So the reassurance is there that everything is available, from the scans to the specialities to the actual theatre complex, and the equipment that we use to actually take the tumors out is available here. And the expertise is available because we have the pathologists who look at the tumor tissues, we have the anaesthetists who anaesthetize the patients, and the aftercare as well, to make sure at the end of the day that the patient goes home safely.
So doctor, going back to pediatric brain tumor, I'm sure the parents nowadays, they're reluctant to identify, like they're reluctant to accept the fact that their child is going through a disease like that. So in that case, what is your advice to the parents out there?
So the first thing to point out is the parents know kids best. There's nobody else that would understand a child better than their parents. So if a mother is worried about the behavior of a child, or a father is worried about the academic achievements of a child because things are getting worse, then the first thing to do is make sure that the child gets the right assessment by their familiar pediatrician. Any good pediatrician, and we have many in this country, would be able to pick up by examining them and assessing them if there is something significant going on. A lot of the time, brain tumors are very rare. They're not very common at all. It's about 1% of cancers all over the world. In pediatrics, it's slightly higher. Children get a higher percentage of brain tumors compared to adults. But at the same time, they're rare. So there may be other cases and other causes for the symptoms as well. So taking the child to a pediatrician or a neurologist is the first port of call.
So when talking about all these treatments, doctor, public would have the question of asking whether it's cost effective, because brain tumor does not come to the people with money and with no money. We can't really differentiate it because it's a disease. So in this regard, what have you got to say whether do everyone has the access for the treatments for brain tumor, doctor?
In Sri Lanka, we are in a unique position. Working in two healthcare systems in the UK and here, the work that the specialists do in the government sector is on par with anywhere else in the world. The only problem that the small problem that comes in, which is actually a major problem sometimes, is the volume of the number of patients that they'd have to deal with is significant compared to other countries and also compared to the private institutions. So in the UK, we have 26 neurosurgical units in the country. In Sri Lanka, it's far, far less. In the UK, we have 300 neurosurgeons. Here, we have possibly 20 neurosurgeons. So for a 26 million population. So it's a matter of volume. The resources are available. The expertise is available in this country. But sometimes you can't get the treatment soon enough, not because of a fault of any of the professionals involved, but because the resources are not available. Now, the private hospitals do have a cost issue. They're private hospitals. But at the same time, when we're treating these tumors, a lot of the cost has been cut down so that we are trying to make it accessible as possible to everybody.
Thank you so much, Doctor, for joining with us today with Art Mediline. It was a great pleasure having you. That concludes today's session on Art Mediline. I'm sure you got so much knowledge and information about brain tumors, and it's always about taking action. And if you need any help and for more details, you can now call the Neuro Center of Lanka Hospitals through 077 253 6387. Thank you for joining with us. See you again with another session on Mediline. Thank you.
Lanka Hospitals. Caring, curing.